The original hospital was Forest Hills General, and it was written on the drawings as a 150-bed community hospital. The original entrance to the hospital was located behind this blue trailer, and it was right next to their emergency department, which had approximately 10 beds. In 1978, I was hired by the Robert Rosengarten Center of HIP, which originally had its entrance right here, which the entrance, as you can see, is still in the same spot. And HIP owned LaGuardia Hospital. In 1971, HIP did their first expansion of LaGuardia Hospital. It was called Phase 1, and it involved adding additional patient rooms and one operating room. And you could see where the building juts out. In 1974, the second phase of construction was completed by HIP. This was a large 10-story tower that took our bed count from the original 150 beds to 300 beds.
So when I first started at LaGuardia Hospital in 1984, it was very different. There were no staffing ratios like there are today. There were shifts where I had 14 or 16 patients. If we had a sick call or we didn't have enough nurses, that we would cover that volume of patients.
I've been here 37 years. In the beginning, it was a little overwhelming for me, although it was a small community hospital, which is what I was looking for. The labor and delivery room was at a smaller scale than what it is now. It had shared rooms, as did the maternity unit. And over the years, it has grown and expanded to a much bigger unit.
So back in the day, the cafeteria used to be on the 8th floor with an amazing view. There used to be dollar lunch specials where you got your beverage, salad, a full meal, and even a dessert for $1. There were good times up there.
Because we grew as an institution, we then took that cafeteria and used it for other facilities for the hospital.
HIP owned LaGuardia Hospital until 1996, when it was bought over by North Shore University Hospital. And the name of the hospital was turned into North Shore University Hospital at Forest Hills. Around the time that North Shore purchased LaGuardia Hospital, the hospital was not doing very well at all. We actually had 3 units closed, and we probably had a census of probably 60 patients. And North Shore came in and literally bailed us out.
I started at Forest Hills in 1999, actually as a per diem admitting clerk. And what's funny is I came here and I would have never thought that I would have been here as long as I have and transitioned in the manner that I had. And I've been in surgery here at Forest Hills in the OR since 2008. I've seen a growing neurosurgery specialty. I've seen the birth of the robotics program because we didn't have that level of technology incorporated into surgery before. We've grown to now have 3 Da Vinci robots here at Forest Hills, and we have a Mako robot for orthopedics. So I couldn't have envisioned that at the time when I came, and you know, for this to be a community hospital, you know, those are things you normally see in larger facilities.
Through my role as nurse educator for the patients, we brought on board the Baby-Friendly Hospital Initiative, which helps mothers attain their goals for breastfeeding. So in 2017, we received the designation of Baby-Friendly Hospital Initiative Magnet Award.
I've worked for the engineering department my entire career here, and over the years there have been many friendships that have been developed here. I met my wife here. She worked originally as a nurse's aide and went through a program and became a registered nurse. And We got married while she was still working here.
The favorite memory that I have here is the birth of my son. And I came here because I trusted in the care that I would receive here.
Just like a real family, and I say this all the time, there's a work family, and there's a lot of good times and bad times. We have a lot of celebrations together, engagements, weddings, births, and unfortunately also deaths and tragedies, both on the unit and throughout the hospital. One of the toughest times in this building and throughout my nursing career was definitely COVID.
We understand that Queens is the hardest hit borough in New York City, and then we heard those awful stories about Elmhurst Hospital where conditions have deteriorated. What are conditions like at your hospital?
Well, we're maintaining patient care. We are adjusting to the needs. We're opening up critical care beds as the need arises. We currently have 2 critical care units up and functioning, and we're preparing to open up our 3rd unit.
I actually got my start at Forest Hills Hospital because I was born here back in 1969. I've been working with Northwell since 2012. Right at the beginning of COVID in 2020, I came to LIJ Forest Hills as Director of Pharmacy. Within a couple of months of me coming on board, as COVID was increasing and we were looking for ways to combat it, we had the development of the first vaccine.
The first COVID-19 vaccine shot given to Northwell Health ICU nurse Sandra Lindsay had been stored inside the sub-zero freezers at Long Island Jewish Hospital in Forest Hills. And it was pharmacist Anthony Longo who prepared the shot.
This is the first dose. This is the first vial. This was the, all first.
You didn't see Longo on camera, but he played a big role in the history-making vaccination.
I believe that Forest Hills is the little engine that could. It's a broad mix of people here, just like you see in Queens itself. It's very representative of the community, the variety of the employees and patients. And people really look out for one another because they know each other.
Over 70 years, a community hospital has grown. We've had some name changes, but we're here. We're dedicated to this community. We're dedicated to quality, expansion, and growth. And we're really dedicated, most of all, to the patients and really understanding their needs and those softer skills to be better and to really serve them and their family members. In this diverse county of Queens, it's really important that we make people feel safe in a time when they're coming to a hospital where they may be at their most vulnerable state. Our team members make that happen. So much of what we've done has been focused and talked about of what we're doing inside the building. But we're doing so much outside of the building as well. We have tremendous efforts in community outreach, going into different communities and different neighborhoods and servicing people where they are and letting them know about LIJ Forest Hills. And we're very excited about the future. We are LIJ Forest Hills. We are Queens.